And the IWK has a new tool to help advance mental health care in the province. Nova Scotia Health has partnered with Green Space Health to equip the Women's and Children's Hospital with measurement-based care. The electronic platform allows healthcare professionals to track patients' progress in real time through things like email and text questionnaires. A psychologist spearheading the project says having the technology will result in better informed treatment decisions and ultimately improved patient outcomes.
So when we use these tools, when we actually use measurement-based care at the point of care and say, hey, fill out this questionnaire and let's talk about it. The key is actually bringing it in and talking about it in your session with a client. Then we see more change. We see a greater likelihood of symptom improvement. There's a 40% reduction in dropouts, so people stay in treatment and they get better quicker.
Nova Scotia Health has a 3-year contract with Green Space. However, the hope is to keep the tech as an integral part of mental health care going forward.
It's no secret that our collective mental health has taken a very huge hit during the pandemic, and it isn't just adults who have been feeling stressed and burnt out. Children and youth have also been greatly impacted, and it's something the IWK is focused on improving. Joining me now to chat about one of the ways they hope to improve mental health care in the province is Dr. Debbie Emberley, a psychologist and advanced practice leader at the IWK Health. So we want to say, Debbie, thank you so much for being with us this morning. It's an early start to the day for sure.
Oh, you're welcome. It's my pleasure.
Debbie, so as someone who works at the IWK, I can only imagine you know firsthand how youth mental health has been impacted by the pandemic over the last 2 years.
Absolutely. Right, and we've been really working hard to build a system of care that meets the needs of young people and their families, and it is able to match them with the right care at the right time and puts their values, their needs, and their voice right at the center of all that we do.
Which is absolutely needed and incredible that it's being done. What is the IWK, if you can get into detail, doing to improve the mental health care in the province?
Yeah, the thing that people may not know is that we don't really have a clear way of knowing if we're making a difference on what matters to our clients. So we check in with them, we can ask them, but we don't really have a systematic way of understanding, are they getting better? Are we meeting their needs? And being able to use that information to have conversations with them about what's working well and what's not working well for them.
So is that basically how you go and find the information that you need to, create a care based on that?
Yeah, so we're using a system that has a term called measurement-based care. And this is where we bring the young person's voice as the expert in their care to the table. So we send surveys and rating scales and questionnaires to ask about how they're doing, to see if their mood is better, is their appetite improving, are their worries lower, can they go to school, are they having a good time with their friends when they spend time with them, and is there maybe less arguing at home? And then we use those measures in real time. We can send this to them and bring it into the session and be able to sit down and talk to them about how things are going and track this over the course of treatment.
And how is this different than the type of care youth in the province are used to receiving?
Yeah, I think that we've tried to use measurement care before, but we haven't had the technology to do it right. And so we've been able to partner with Green Space Health to really give us this technology that's going to help us do this well. So now, before we'd have to use paper or send things to people by email or even mail in the past. And now we can do it in a way that's much more acceptable to teens and youth and their families. And we can send it to them by text and by email. We can work on these questionnaires in session with them on their own devices or on ours. And we can really see in real time how they're doing and then be able to have conversations about what's working well. And most importantly, be able to know when things aren't going well and make changes early.
And that's the key, changes early. How important is it that young people feel engaged and have a voice, that they feel care about them and have an outlet?
Absolutely, right? When we can bring them into that conversation and really get their perspective on how things are going. They are the experts in their care. They are the experts in their lives. They know what's working for them, what's not working for them. And so when we can really show that and bring it up on a graph in front of them and say, hey, you know what? This is where you were when you first came into treatment, and all things that aren't perfect right now, we're seeing such a big improvement. And when you put that in front of them and have those conversations, then we're able to have better outcomes and they feel more engaged in their care.
Sometimes you just need to see that progress. How does that impact a youth and maybe even their families in Nova Scotia to see that?
Yeah, I think it has a big impact on being able to have that perspective. You know, mental health care and mental health treatment can be a journey for families, and you may start at a point where things are really going quite poorly, and you're at a crisis point, or you're really at a time where you're reaching out for help. And then over time and through the work that they're able to do with the guidance and the expertise from the clinicians that they're working with, they're able to make those changes over time, and then being able to sit down and say, hey, you know what, look where you are, and look at all the things that you've been able to do and make changes in your life. It's really an empowering opportunity.
I'm just so thankful that mental health is being talked about at such a young age, and they don't have to struggle in silence if they don't want to. So thank you so much for joining us, and thank you to you and your team and all the hard work you've provided over the last couple of years. It's just been incredibly tough, but we're making it through. So thank you, Dr.
Absolutely.
Debbie Emberly. I appreciate it.
Thank you.